Morning, everyone. Good morning. Welcome to this session on connecting 11 billion machine devices. My name is Janine Vos. I'm the Executive Director for mHealth and Education at the GSMA, and it's my pleasure to chair this presentation and panel discussion. For those of you interested in M2M, I hope you've had an opportunity to go see the Connected City. Or maybe that you will do so later today or tomorrow. Because I thought it's really very exciting how over 100 different exhibitions have come together at Mobile Congress that really show an impact on how people live their lives, how they learn, how they work, how they move around on a day-to-day basis. You can see how in the Philippines, young people can get education certifications using mobile services. You can see how basketball players, how professional athletes can be coached and improve their performance using smart kits. Or you can see connected toothbrush, connected cars. The opportunities are really endless. And I think the other really exciting thing is that these are no longer services of the future. These are services that are really being offered today. The GSMA launched a report recently on the status of the M2M market. And in 2013, we already saw 195 million machine-connected devices around the world. The same report estimates that we'll reach 250 million this year. So there's really, the start of a real growth opportunity for the mobile industry here, as well as for all the connected parallel ecosystems. And so today we'll talk about how do we get from that 250 million this year to 11 billion, an estimate that was put out by McKenna Research for 2020. There is still a little bit of a gap from 250 to 11 billion, but how can we work together as an industry to reach that opportunity? What are the key steps a mobile operator needs to take? What are some of the recommendations from people working in this space to really develop these opportunities? What are the technology enablers or the policy and regulatory enablers that will help us reach the 11 billion. And so to discuss these points, we have broken up the session into two parts. First, you'll hear different perspectives through 4 presentations, and then we'll have a panel discussion. Also, you will have an opportunity to ask questions. So first to speak will be Nazrin Dayani of AT&T. She's the Executive Director and Head of Health for AT&T. She will share her insight as to how mobile operators can take advantage of these new opportunities and develop these vertical services. Then we'll hear from Irfan Goandao from Ooredoo. He's the Group Associate Director for Innovations. He will speak more about the technology requirements and capabilities that mobile operators need to develop in an M2M world. Then Thierry Zilberberg, who's the Executive Vice President and General Manager for Health from Orange. He will talk about the importance of partnerships and realizing this market opportunity. And finally, we'll learn from Mr. Mike Short, who's the Vice President of Public Affairs at Telefonica Europe. He will speak in particular about the regulatory environment that will enable these innovations reaching the market. First, to kick off, I would like to invite Nazrin Dayani to give the opening presentation. Thank you.
I just want to make sure I get this right. Jenny, which one is to move forward? Okay, thank you so much. Thank you. Good morning, everybody. And if you haven't heard enough of the statistics about the connected devices and how it's taking over the world, let me just share a couple more with you. I think what's interesting is that UN predicts that there's already more connected devices than computers and toilets and toothbrush globally. That puts things in perspective. And also by 2017, when we reach that number of the 10 or 11 billion connected devices, that would be 1.5 device per capita. And the source of this is Cisco Visual Network statistics on global growth of the connected devices, for those of you who wanted to know the source. What's important is that this is truly a global phenomenon. It's truly across all socioeconomic and age groups, and the empowering aspect of that is what is going to impact all of the verticals. So let me just put a human face to that. In US, we see a similarly very impressive adoption of mobile technologies in healthcare. As Janine said, I have particular interest in that vertical, and we see how the consumers are adopting and using the mobile technologies for managing their healthcare. Over 95 million people have been using mobile device to access healthcare information, and exceedingly they are going to the internet and social media to get advice on what to do. Now, why is this important? For those of you in the Mobile World Congress, it's like, okay, well, so what? But for some of us that have been frequent participants in the health information technology conferences, and you have been in so many seminars and sessions around how to engage patient engagement, and consumer adoption being perceived and portrayed and framed as the biggest barrier. This is very eye-opening. That's not the barrier. They are, in fact, using and adopting these solutions in a very impressive fashion. And what that makes the point is that these same consumers will be the ultimate jury in deciding that best application, best connected devices to be used for their own healthcare. Now, in AT&T, we have made that a cornerstone of our approach. When we are designing mobile healthcare solutions, we are relying on open and collaborative platforms that puts the patient identity in the center of the design, so that as they pick their own applications or devices, that can still be seamlessly integrated to the rest of the ecosystem. And I'll talk a little bit more about that. But the empowering impact of the mobile connected device and adoptions in healthcare industry has been really game changer in US, and I'm sure it will be a game changer in other countries as well. Similarly, on the industrial and stakeholder side, we know for years that the technology is connecting the peoples and is really empowering the interconnection of commerce and industries globally. And the industrial internet is taking that to a new level. It's a global open network that is connecting machines, people, and data, and as such has such a significant opportunity for improving and boosting the global economy. Again, going back to the healthcare itself, by 2011 was 10% of the global GDP, and it's increasing, but it has on average 10% waste year over year in the healthcare, and that's about 700 billion annually. And it's expected that adoption of mobile technologies and mobile solutions can improve and address 59% of those inefficiencies, not just through care collaboration and work management and having meaningful data, but through elimination of unnecessary procedures and expensive tests that are totally not even needed. And the personalized data enables the industry to eliminate those unnecessary procedures. But even if we just achieve 1% improvement year over year, we are talking 4 to 5 billion year over year savings. So just in the healthcare vertical, the opportunities for enabling these stakeholders and improving their efficiency and effectiveness is immense. Now, how do we do that? how do we deploy mHealth solutions? And this is just a conceptual framework, but we also follow this framework in our own solutioning. So we start with engagement. We start with that consumer being the center of the design. And one can define and develop their own applications. Most providers and payers in US are betting on their applications being that killer app adopted by the 350 million. And some are not. Some are designing an open platform that through the use of open APIs, whatever app or connected device the consumer has chosen to use can be incorporated into the workflow. So infrastructure and integration becomes a very critical aspect of the design. And you have to answer the typical design issues, right? The data storage and the scaling of data. Now, the magnitude and explosion of data makes the data storage totally different challenge. You know, it's not going to be resolved by traditional solutions. The scaling and analytics have gained a new meaning, and new industries are being developed around those challenges. Identity management. So it's really nice to say that, well, we allow the consumers to pick whatever app and whatever connected device they choose, and we will still integrate that data into the rest of their well-being wherever they are and whatever provider they choose. But then the challenge becomes identity management, and in the healthcare, that has totally different meaning. So your identity cannot be, okay, it's the phone. So it's fine that I know this phone was used in Barcelona, so if I log in again, Google will give me all the restaurants in Barcelona. We can't do that in the healthcare. It has to be assured that it's Nasrin who picked the phone and not her husband who happened to be in the same hotel room. So it's really the identity management has totally different challenges in the healthcare. And then the data sets and how to create authorizations and around that, and the rule of engagement, that has additional challenges in healthcare. And of course, security that you all are very familiar with it across the board that needs to be managed. But the other side is that integration with the legacy systems, the acknowledgement that as much as that with the speed of light, the adoption of mobile devices and technology is going ahead, and the patient and consumers are embracing it. At least I can say in the healthcare industry, that's not with the same speed, to say the least. So you got to recognize that you will be dealing with legacy systems for many years to come. But to achieve those efficiencies that we talked about, to achieve eliminations of waste and bring that real potential of the mobile adoption of mobile by the patients, we need to do integrations with the legacy systems. We need to make that seamless integration into the physicians or the hospitals. So to solve for those legacy integration is just as important. Now I'm using the healthcare as an example, but I'm sure that other verticals will have similar legacy integration challenges. And then third, last but not the least, is all of the operational aspects of it, right? The logistics of the device management. So many of these medical devices are very expensive, so through the connected technologies, they can all be also managed and with the predictive analysis, and there are so slew of savings that can come from that. Now, few companies can solve this holistically. Thousands of companies are focused on number one, coming with that cool device or cool app. There are companies that are focusing on data analytics or how to solve for security. But you really, as many of my colleagues have talked previously, you need to bring it together, and you need to bring it together through collaboration and partnerships. So examples of, just few examples of what we have done with that approach in the connected living and connected home. some of the examples you heard about digital life from AT&T as relates to home security, and but we also have mobile personal emergency response, remote patient monitoring, and highly, simple use of secure text messaging. These are all, once they are part of the platform and once they are integrated into the workflow and connecting the end user to their physicians, providers, they get totally different meaning. It's not just a text, secure text messaging. It's my life connection to my healthcare providers. And other examples that you all have talked about, text that connected living to a different level. And just as of end of fourth quarter, AT&T had 1,800 connected devices certified on our network, and we already have over 16 million connected devices, M2M devices. So some of these billion numbers are really not M2M devices. They are any kind of connected devices. So over 16 million M2M enabled connected devices is pretty impressive given the short amount of time. And it's across the smart city, connected home, connected car, and mHealth. We are doing it. Now, what to expect? We expect a more emphasis on simplifying these solutions if nothing less, because the consumers now expect it. Their experience, their expectation has been reset by use of white screen of Google, or the design that Apple has introduced, or the one-click buy of Amazon.com. So there's a new expectation and standard for simplicity. Now on the M2M, that technically means a global SIM. You don't want to know where you are, what network, what country you are. You want to just be connected all the time, and make that integral part of the device will play a key role. Making informed decision, that's all about making sense of the explosion of data. We believe that very shortly there will be more healthcare-related data coming from connected devices and app than the entire digitized health information record. So to make sense of that, and real-time decision making is very important. Improving customer experience really ties to the verticalization. To improve that customer experience, you need to tie to the business flows and the workflows and make it so seamless integration possible, so that customer experience is really enhanced by the adoption of this solution. And obviously, last not the least, is expand product innovation. So if you look at where we were 2 years ago with M2M and where we are today, you see that an innovation has played a key role and will continue to play a key role. So one of the things we have done in AT&T in recognition of that is creation of our Foundry, which is really an innovation lab that is open for collaboration between the customers as well as our partners and our own technical people to continuously collaborate on how to design the next M2M device and how to integrate it into the workflow. And we believe that will be the way to move forward for the next few years as well.
Just to kick off, just a couple of words about Reader Group. We recently rebranded last year, so it's a new name. So it used to be QTA Group. QTA Group was basically a one country operation out of tiny Qatar for a few years back, and now we're expanding towards 18 markets and around 100 million customers across the globe. So we have kind of presence in Middle East, North Africa, and Asia, and as you can see, all of the markets are very diverse, very high ARPU to very low ARPU, and that actually is a strength because it keeps us in touch with various sort of dynamics in the telco sector and keeps us on our toes to do the right solution in the local markets. For 2 years back, we started focusing a lot on new business revenues in the digital services space at a group level, and the mandate was to diversify our business into other sectors than just core services, and also kind of building the DNA at a local level with our course to start kind of diversifying their revenues into new businesses. And in that space, IoT has been a very core focus for us, especially last year, where we spent a lot of time at the group level with our opcos to develop our strategy and plan for that area. And working during that period, it's evident that the opportunity is massive for the whole ecosystem, but also for the operators. But at the same time, there are a lot of challenges for the operators to expand into the value chain and capture more value than just connectivity. So if we look a bit around, I'm trying to build up the rationale why this is important and why it's so complex and what we need to do. So if you look at what's going on in the space of IoT, and it's also, then you also have to look into what's happening in the space of digital transformation. I think we are witness to that. Digital transformation is happening in all over, all aspects of our life these days. So there are a lot of dynamics in that space, and connectivity is one of the important aspects of making that happen, basically. So some of the kind of drivers in that space are technological. We see the availability of sensors, hardware that are becoming massively available. Cost is going down, form factors are going down, so it's becoming much easier for solution developers to make a lot of innovative solutions in various spaces. It's also environmental. We are scarce of resources. There's a trend for enterprise companies to reduce their carbon footprint, make more energy efficiency solutions, make more efficient use of our resources globally. That's definitely one of the trends also driving the whole scene. And also from network side, that we can see that network cost is coming down with LTE deployment. Cost per bit is coming down massively. Roaming costs are coming down globally, enabling a lot of verticals, especially in the space of automotive and also logistics area and consumer electronics as well. There's also a strong focus from the political side in this space, which is around especially health that my colleague just spoke about earlier. The cost of health is exploding, so the governments are looking to reduce the cost of health, where mHealth, eHealth sort of initiative are picking up quite some traction. But at the same time, the governments also want to run their cities and governments more efficient, and that's giving rise to smart cities, which is again a massive IoT opportunity. So all this said, so how is that becoming economic? How can a small, medium enterprise actually tap into that? And that's where the servitization, cloudization of all those platforms that are out there, allowing even smaller enterprise to enter into the space and make their business processes more efficient. So instead of making a big investment upfront, they can basically buy IoT sort of things as a service and get started. And on the social side, we know that I guess a lot of you are wearing Fitbits or Jawbones and so on, and clocking up 50,000 steps per day. And also the need for security in the homes, automated homes. So there's a social trends for IoT as well. So those are some of the factors that we saw that are influenced in this space, and that's why it's so massive, but also very complex to enter. But we see that connectivity is actually one of the essential elements of all this happening, the digital transformation happening around us. So that is an evidence that we definitely have a strong play in that space for the coming future as well. So a couple of few announcements that happened lately is especially the Google one around Nest that everyone has been talking about. $3.2 billion for a thermostat company. So, well, it's not a thermostat company, but it's actually an IoT company, that's people are saying. And this sort of acquisitions also give rise to a lot of other similar companies. So this is fueling the whole ecosystem around developing solution and service in this space, which is good. And we know that Apple has recently announced patents in the space of heart rate monitors. So we will probably see iPhones with the built-in health sensor and so forth, which is again a massive market for that space later on. But I'm most kind of interested in what Telefonica won last year in UK, which is giving the telecom community confidence that we have a strong play in this space. I mean, 1.8 billion pounds in one deal is massive. So we need to build our capabilities in space to be able to capture those deals. Otherwise, a third-party company will run with that deal if we haven't got our capabilities in place. I think Telefonica has been early out in building the capabilities in that space and actually managed to win this one, which is great. So again, if we look into the complexity and the opportunity in this space, we try to categorize that in 9 verticals, which is basically how the industry look at it. So we haven't done anything new in that space, just trying to clear our thoughts. So I mean, we're in consumer electronics, building security, energy utility, industrial automation, automotive, transport logistics, healthcare, public, retail, and finance. So the question is here, should we do everything in-house? Well, the question is no. I mean, telcos are very, very poor at doing innovation in-house. We know that. We lost some of the battles towards the OTT in that space already, trying that. So we need to be an enabler in this space in a way that we can still maintain a strong relevance in the value chain without building in-house vertical expertise at a level that we have to develop everything in-house, because that's not going to happen, and that is most likely a recipe for failure. So we need to kind of understand what are the needs of those different verticals, what are the common needs of those verticals, and make our platform agile enough to deliver different sort of quality of service, different sort of self-management tools, different sort of package solutions. So small, medium enterprise companies actually can just take a package sort of solution and plug into their business processes and harness the efficiencies in that space. Actually, I was just talking to a colleague yesterday, and he was mentioning that 60% of enterprises actually doesn't know anything about IoT. So imagine the potential in that space that we are looking towards. So just quickly, IoT, again, complexity. I don't want to make it too complex. Just some quick pointers about why what we kind of saw and what we need to do in that space. Well, currently the M2M projects are very complex. We are talking about deep integrations to a big enterprise companies and taking a lot of time and so forth. We need to look into how we standardize that. Connectivity, it's not always mobile connectivity. There's different wireless connectivities available to enable solutions, which means that we have to understand, do we deliver a complete solution embracing all sort of connectivity, or do we just look at mobile? And I think we have to look into end-to-end solutions to be having a relevance in that space. Technical challenge in terms of how we design our network, how we test our SIM and devices in that space. A lot of questions about safety. How do I as an enterprise protect my data? How do I implement, is data network secure, and so forth. Regulations are very kind of legacy oriented, not futuristic in terms of working with these things we look at. And again, how do you actually take this to market? Is that in-house or with partnerships and so on? So just to quickly summarize, this is the last slide. So we kind of concluded that it's very important to embrace partnerships in this space. We need to look into vertical specialist companies at a local and a global level to be able to enter this space and make a difference. And there are a lot of smaller enterprise companies that love to work with telcos to get a market footprint, and there are tons of companies coming up in that space. But M2M is also a global business. In that, for that, I think one of the colleagues is going to touch upon the importance of partnerships that we need as a telco community to work together to harness some of the global leads with Toyotas and Amazons and whomever out there. So how do we connect all those partners to our telco platform? So first of all, we need to look into dedicated machine-to-machine or IoT management connectivity platforms that can service various sort of sectors and also provide the enterprise companies self-care tools so they can manage their business themselves rather than continuously going to the telcos and asking for support and services, because we won't be able to do that. So the system needs to be as much customer-oriented as possible. And again, as my previous colleague mentioned, API, standardized API in that space are very important to connect to all sort of enterprise, vertical specialist companies, aggregators, and so forth. And again, not to kind of, standards is a given thing. Standardization is very key in this space because the ecosystem is so complex. So we need to look into harmonization of the standards in all aspects of the ecosystem to fast track the whole deployment of IoT. And that incorporates APIs, testing devices, and global SIM. And the last one is we need to educate the regulator in this space. We are facing a lot of issues around, well, is the personal data traveling outside the country, inside the country, and so forth. And the nature of IoT vertical specialist companies, they are working globally. So in order to get economy in a solution, needs to work global and not local. So that's an important aspect that we need to work with the regulators a lot to develop their thinking in that space as well. Yeah, I think my time is up as well. Thank you.
Whoops. Maybe you shouldn't have done that. How many of you are within the healthcare industry? One? Raise your hand. Be brave. Okay, one. How many of you are from the telecommunication industry? Wow. Okay, all right. That maybe will be part of precisely what I will be trying to approach here. I'm Thierry Zilberberg. I'm head of the Orange Healthcare, which is the healthcare division we created 7 years ago. And perhaps what I wanted to do today was to reflect upon the two questions that Janine asked me to address here, which were regulation and partnerships. So is this the thing? This? Yes, this is it. Basically, okay, maybe I should be here. Maybe it'll be best. We do three different type of things at Orange Healthcare. The first one is we try to address communication within the healthcare professional environment. Maybe to answer some of the questions that the previous speakers addressed, we decided that our job was to transport and store securely medical information. We are not in the business of delivering healthcare services. This is not what a telco expects. What people expect from a telco, and this is not what we are good at. So we're trying to see what we can do in transporting and storing information within the healthcare professional space. We're also trying to address different categories of services, which are remote monitoring services, medical information coming from a patient and going to a professional. It's a different type of information. In the first one, you'll have a huge amount of information. Just to give you an example, we are currently storing all the medical images of 38 hospitals in France. So it's a cloud computing applied to medical imaging. We have more than 2 million exams which are currently stored, and this is growing at a very fast pace, as Nasrin pointed out. So this is a huge business, and we're trying to expand that in many other geographies. In the second domain, as you know, there is much less information which is going on, but it's going very continuously, so it's different. And there is a third activity which I will not cover here today, which is more of a consumer play where we offer information to the general public. For example, we've launched recently in Cameroon a health line, which is a telephone number. Actually, it's an SMS number where people can inquire medical information. Just to backtrack a little, this is a very busy slide, but what we see is that data has actually two roles in the healthcare ecosystem. One is that of a management tool, because you need it to measure, analyze quality, security, so it's used as a management tool. But it's also used as a clinical tool, and it is a very different type of data, because here you are talking about the data of a patient, and this has to be very secure. So basically, we are seeing this ecosystem where there are a lot of modalities creating data. So they could be scanners, MRIs, but they could be small glucometers. And at the other hand of the spectrum, we are transporting this information to be analyzed and treated and processed by medical software or by general administration software. So you see, it's a very complex ecosystem. And in fact, and precisely, I believe this is where a lot of the previous speakers have addressed the point. E-health, M-health, is at the intersection of very different ecosystems. And the fact that today there is one brave person from healthcare here and 99% from the IT ecosystem show that this collision of galaxies, which I've tried to show here on the slide, hasn't really happened yet. It has happened here and there, and we can see progress, but as you will see, it has an impact on regulation, and it has an impact on partnership. Because they're very different ecosystems. They're very regulated ecosystems. There are ways of working together which are very different. Obviously, we are very comfortable. Well, comfortable may not be the term, but we are now in our mobile world working together with the OTT and trying to define that balance. But in the medical world, it's very different. And then you have payers, you have device manufacturers, you have pharma company, you have insurers, you have a lot of different ecosystems. And precisely because these two need to come together, we get to this question, which is where exactly is the collision? What is happening there? And we get this equation, which unfortunately is not very good for us, which is if you add the medical regulation and you add the IT regulation, you don't get a simpler picture. You get a much more complex picture. And the regulation challenge is, I believe, very important here. If you, and I'll give you an example later on, if you create something which is a communicating device, then you may be entering into the medical device space because you are transporting medical information. That means that you have to go to the FDA and get approved. This is something that the 99% which are present here have no idea how to do. And you said educating the regulator. If you want to educate the FDA, good luck. And if you want to, and maybe the FDA is actually not the worst. Now, you can go to the French regulator, and then good luck. Then you can go to the British regulator, and it's just a nightmare. So you have to take that into account. It's impossible that you can enter this world and say, I will educate the regulator. I'm contradicting you on this point. They've been around, and in fact, they're very concerned about safety issue. Because their problem is very different from your problem. Your problem is you want to connect the world. Their problem is they don't want to have any public health scandal, or they don't want to have death. And it is something that we don't really encounter in our world. But for them, it's essential. So you have FDA, you have the CE marking in Europe, and that's an issue. But then there is the issue of hosting health data. So not only is it the issue of public freedom or public liberty, if you want, but there are very stringent health data regulation. And I guess one of the most stringent is the French one, because the French government passed a law which says in order to host health data, personal health data, you have to be approved by the government. It's an 8-month process. You have to fill in an incredibly thick dossier of 1,700 pages, and then maybe you will be approved. In fact, you may think this is red tape, but I don't. I think that is a good step, because one of the issues that I get asked many, many times by reporters and basically citizens is, are my data safe? So in fact, the fact that the government issue very stringent regulation, I think is a good protection. And as you know, there have been many, many scandals of health data, of some administration being available on Google, and it's been true in every country. So I believe this is something where the government can do something. And obviously, all this regulation needs to come together. Today, it's really embryonic, but I think it will move forward. Creating this chain that some of you have described before requires not just a partnership where I have the platform, you have the device, you connect to the platform, and we're very happy together. Because in fact, when you look at the value chain, it's a bit different. So the solution is not M2M or IoT. This doesn't work. It's not a purely medical device, because the medical device company, they come to us and say, could you help us make our device more communicating? So it's not a medical device issue. It's actually a new value chain. And this is something we've done with Sorin, which is an Italian company which manufactures pacemakers and defibrillators and their implants. And we have to devise with them a brand new value chain where they provide a bit of the transportation, then they have the implant. They built a very small transmitter, which is a home monitor, which sits on the bedside of the patient. We help them do that. So here, the frontier wasn't too clear. Then from then on, we took the information. We stored it on our back office, but then we had to give it back again to them so that they could send them to the physician. So you see, it's a very intricate relationship, and it's not a relationship where I'm just transporting the data, I don't want to know what's going there. Obviously, you don't know what is in the envelope, I want to take a postal metaphor, but still the value chain is much more intricate than just I'm handing the information. And today, this is very successful. We have more than 2,000 patients connected with this device, and it's growing very nicely. It's available in 11 countries. And we've been doing the same thing with respirators and glucometers and other things. And perhaps a bit of advertising here, just to tell you about the partnership issue. We launched together with the GSMA what we call the MLS Grand Tour. That was a bike race between Brussels and Barcelona in September. And we had a team of riders which are type 1 diabetic. They're actually here on the orange stand, and you can see them ride the bike. so the team of bikers there. And we did this thing where we constantly monitored their glucose level during the whole race, which, as you can see, lasted 13 days. So that required a partnership between Orange, the GSMA was a sponsor. We worked with a medtech company called Dexcom, and it took us a couple of weeks to just align the two, let's say, the two companies on how we would do the thing. It wasn't really rocket science, but it took some adjustment. But again, if you want to deliver medical information, this was medical grade information, the University of Newcastle was actually our academic partner in there, you have to work very closely and not just transport the information blindly. So that was my message, just to introduce the subject. Thank you very much.
So good morning, everybody. My name is Mike Short. I'm not going to use slides because I know you've had 12 sets of slides so far. Also, the two previous speakers put the Telefonica logo on their slides for me. So thank you very much, Jerry. Thank you as well, everyone. I'm going to talk about some of the public affairs issues, particularly in relation to Internet of Things. And I'm going to do that in the context mainly of health, but also then bring out some of the lessons from smart metering, which I had a hand in the UK. And although it's worth a lot of money, it was tough, and there are some significant public policy issues in there. But I'd like to start by applauding the GSM Association for putting the emphasis on connected living, because actually the world is changing so fast, and we need to actually provide solutions for connected living in a variety of ways. When I was chairman of the GSM Association 18 years ago, I started the first mobile data initiative, and that was simply about getting texting going, getting mobile email going. Now just imagine all the services that connected living requires. Think about how we need to build the ecosystems, the partnerships. If GSMA is not going to do this, I don't know how we're going to move this forward. We need that right sort of consistency to keep it going. So I applaud Janine and some of your colleagues work in that area. I also, on Monday this week, in the room next door, chaired for Telefonica a session on accessibility and inclusion. And that is a particular example where mHealth can make huge differences. It's a market of 1 billion people, 1 billion people who have a disability of some sort. And when you also think about some of those solutions suiting the elderly, people who are 60 years and above, like myself, you start to realize that we're all going to need these solutions, mobile internet solutions, such as text to speech, speech to text, voice-based dialing, voice-based search. We need to find ways of getting more of those services accessible, available, and more broadly known to our industry. Now, it may not be things, Internet of Things, but it's services. It's an Internet of services that we should be thinking about from the point of view of accessibility and inclusion. So just in terms of themes, I thought I'd touch on the what are we trying to solve perhaps with public affairs. So what challenges do we see? Then talk about the why. Why do we need all this regulation? Because I think we just need to understand that. And then list some of the regulations that we need to address in this area with particular reference to health. My definition of health is much more about sports and wellness. It's about healthcare and social care. It's also about assisted living. And I think that's quite an important, broader definition than the typical e-health, IT-orientated definition. So sports, wellness, health and social care or assisted living. And when we see in some parts of the world that some countries do not have access to a doctor or to a physician or to a nurse or to a pharmacy, frankly, mobile internet is a fantastic way of accessing some of that access that you may need to prevention, care and cure. Parts of Africa that don't have those facilities or clinicians. In addition to that, we see in many parts of the world a lack of clinicians available generally. So it's not just the distance issue, it's actually getting access to those clinicians and pharmacies, which I think is one of the first challenges we need to think about. From a Eurocentric point of view, we know we have plenty of hospitals, we know we have plenty of clinicians and pharmacies, but actually, even in Europe, they're not always as accessible as we'd like. In the US, there are some issues as well. We see something like 18 to 19% of GDP in the US on healthcare. It may only be 10 or 11% of GDP in Europe, but it's still a big number, a $12 trillion market. The second thing that we are talking about here with e-health is better access to information. Can you imagine not knowing whether a pharmacy has the drugs before you set off and walk for 2 days? Isn't that ridiculous? You need to know that they've not only got the drugs in stock, but also that they're the right sort of drugs. Otherwise, you're not going to get the care you need. Measurement at point of care. Thierry very eloquently described some of the areas where telehealth can be handled through monitoring and remote measurement. Transmission of data to the clinicians. We have to handle that securely and sensitively, as you said earlier on, from an AT&T point of view. We also have to think about new approaches to healthcare from a productivity point of view, because frankly, there aren't enough staff in healthcare today. With aging populations around the world, there are not enough staff to care for us all. And finally, patient-centered care. How do we make it such that the patient knows it's their body and knows what they need? How do you make it patient-centered? Mobile is key. I saw a demonstration on Monday where there are some devices that can identify not only is your phone in your pocket, your jacket, or in your suitcase, but also your direction of travel. Now that starts to open up different conditions, which are quite different opportunities in terms of identifying whether you are stable or ready for a fall. Just imagine fall detection mechanisms where mobile can make a difference. So let's then think about why do we need to regulate this area? Well, I think some areas have been talked about, but understanding and awareness is still very poor. Thierry very eloquently described 2 sectors, and those 2 sectors do not connect very well today. We need to raise the understanding and awareness to do with e-health. How do the health technicians get to understand what mobile can do? How do they help, or how can they be helped with better IT support? And therefore we need to think about raising that understanding and awareness to help them transform as well as to provide the opportunities for patients and our industry. Secondly, we have to build and strengthen patient confidence and trust. It's primarily about the data. Often if it's the patient's data, they need to know it's in the right hands. But it's also about not being too techy about it. In e-health, I don't like the term Internet of Things, because actually when we talk about patients, we're talking about people. And in terms of people, they need to trust the services that we could deliver. We need to get better cross-sector reliability. So these lack of joined-up regulations or too many regulations that trip over each other just do not help. They confuse. We also need to get the right distribution channels physically and on the internet working well. Some of the pharmacists actually would be great distribution channels, but they need the encouragement and support to kind of get ready for mHealth. We certainly need the appropriate levels of certification and even external audit. Where should that come from? Should that be part of regulation? I think there is a case to say that it should. Patient safety needs to be at the center of all of this. Otherwise, we're going to be in real trouble with real liability questions. And last but not least, I think there's a need to regulate where the records are kept and how the data can be collected. Because unless we do that, we will not have the trust I referred to earlier. So change in this area is not easy, but e-health actually, with mHealth as part of that, is a major force for transformation for health and wellness. We've seen it in the bike ride just described, but there are many more opportunities. So which regulations affect this innovation? So we know that today there are medical devices directive. We know also that there are telecoms directives. Some of the approvals we have to face are quite different to the medical devices directive here in Europe. We know in the US there's the Food and Drug Administration and they have their rules. But when we get into a world of apps, we've got to be very careful about the apps because they may have some regulation associated with them as well. How do we make sure those apps have the right level of trust? So in Brussels, they are planning in March to do a green paper on mobile health apps. And that green paper will be there for consultation for 8 to 12 weeks. As an industry, we need to respond to that to say, don't stop the innovation, do build up the trust. How do we get proportionate regulation, not crazy regulation? How do we make sure those apps can fit the world of e-health and mHealth? We need to make sure that the data privacy and protection rules, as they evolve, also are consistently handled. We need to think a little bit about payment services. In Europe, there are some payment directives. If healthcare is going to be paid for, per minute for consultation or per hour for consultation. We need to understand how payment regulations may affect that. Certainly consumer protection and liability is also an issue in this area. So the more consumer you go with the Internet of Things, consumer regulation has a big part to play. And finally, let me just say a little bit about skills definition. Some of the clinicians, some of the nurses, the doctors, they are not trained in ICT. It could be the case that we say as an industry, can we help with your training in terms of making sure you have the ICT literacy to understand where mobile can make a difference, to understand where computing can make a difference. We cannot rely on the digital natives. We have to think about how do we train all the clinicians so that the digital immigrants do not feel threatened by our technology, so they can adopt it positively as a force for good. So in conclusion, I think we need proportionate regulation in this space. I was very pleased to be involved in the launch of the second European Health Apps Directory in November last year, an organisation called Patient View that have listed 350 health apps on a website called myhealthapps.net. That's 350 apps for almost any condition, blindness, deafness, diabetes, blood pressure, 350 apps, all nominated by patient support groups. On the web, it's the second annual edition. I suggest you have a look at it. It's myhealthapps.net from a company called Patient View. They'll add more apps to that, and I wouldn't be at all surprised if by the end of this year we don't see 500 to 600 in that directory. But the solutions are emerging. We need to make sure the regulation fits that in the right sort of manner. Thank you very much for your time.
Thank you very much to all the presenters for your great thought-provoking insights. That sets a perfect scene for the continued panel discussion. I would like to invite back to the stage Nasrin Dayani, Tilly Zilberberg, and I'd also like to invite Dr. Li-Kun Xu, Chief Scientist at China Mobile Research Institute, to join the stage once they finished putting all the chairs in place. Thank you so much. I'd also like to invite Fredrik Åkerlind, who is Vice President of Sales and member of the Telenor Connection Management Team, as well as Olle Isaksson, who is Head of Transport and Automotive at Ericsson Global Services. Thank you very much. Welcome. Dr. Li-Kun, maybe to start with you. You work for China Mobile at the Research Institute. Could you maybe explain a bit more about the work you do, the key opportunities that you see for the connected living space, as well as share some thoughts on some of the barriers or enablers that have been discussed in the various presentations?
Right, okay. Can you hear me? Yes. So China Mobile is actually working dominantly in China's market. Basically, we have phenomenal number of subscribers. That's the case, and also we've been working. I think in terms of infrastructure networking side, we are a bit lag behind this Western Europe and North America, and so we are last December, so started deployment the 4G services. Mm-hmm. But basically, infrastructure, the coverage from second generation, third generation, fourth generation, it's now all in it's fourth generation first space, but the coverage for second and third is very widespread in the country. So with this infrastructure in place, we are thinking about, just like other telcos, that we are looking at these new applications, shift from a traditional voice-based revenue to a data-based revenue. And the Internet of Things, or machine to machine, is a key area that for future growth of China Mobile. So across the space, we are working in various, if you say IoT space, we are working in mobile health, connected vehicles, and also we're working with the power industry, electricity industry on the smart metering, smart grid issues, also in education aspects. So these are things perhaps not, as advanced as we expected. I mean, compared with what we heard from AT&T, from Orange. But it's steadily in the space working in these areas. Later on, perhaps I can give a few examples regarding this. I mean, the barriers that you mentioned, so opportunities, I don't want to say, speak more about opportunities. I think opportunities, as we all realize in this current mobile internet world, that we have to contribute from our sort of basic infrastructure, from that open the network API to connect, to build up platforms, to connect more devices onto our network. But the barriers, I think, at the moment in China, I think China's situation is quite unique in its own sort of position, because the government now is very encouraging. You know, they look at quite far side. I think this new government look at this sort of the convergence between information technology and other traditional industry. But there's various policies in the sort of guideline umbrella to support this area of work. So, in reality, is that all the sort of regulatory issues or all the way how to implement this kind of policy is not clear. So its market is quite sort of fragmentation at the moment. There's no clear sort of either sort of technology standard. So 3 telcos operating in China, we all have our own different ways of looking at this space, and different network. It's actually different sort of platforms, and the devices are not, customers not connected to each other. So these are issues. There are also as mentioned by earlier speakers about these ethical issues. This data security issues is all, just like in other areas, often have various bad news or scandals heard that this data been leaked to other parties. Yeah. So that's if I see that the other barrier, I think, is so we're lacking of a unified the vision between across industry, because from our part, the mobile technology and IT is very fast moving. It's look forward, but the traditional industry is just still looking at their own way of doing things. So we need to have, when we're talking about mobile health specifically, we're working with the hospitals, but we have to really working side by side with them to not just generate a solution, have a platform, have devices available from other vendors. So collect, okay, we have this thing available for you, so you can do remote cardiovascular disease sort of checkup or prevention, etc. But they do not trust this. So we have to work at the beginning, all the requirements from user requirements, professional healthcare workers' requirements to find the whole workflow or this clinical process. So to get that, build up their trust, build up their interest. So then they think, because they always have ways in China, the scales of medical resources. They want to project their expertise, their know-how to other from big hospitals in the metropolitan cities to remote areas. So they have this desire, but they just don't know that there are possibilities. So we have to work with them throughout the build up a strong partnership. Sorry.
Thank you very much. And Frederick, I want to ask you, could you maybe first explain a little bit more about Telenor Connexion, how it's different from a traditional mobile operator, and then also pick up one of the other key themes around partnerships. We've heard a lot from Nazrin and Thierry about the importance of partnerships for mHealth. You work on a range of other verticals as well. How do you see partnerships coming into play there?
Sure. So Telenor Connexion is the center of excellence for machine to machine within the Telenor Group. We basically grew out of being part of the wireless carrier situation or mindset, if you like, constantly battling the consumer side of the business, where we will always be deprioritized because of revenue. So we launched our own company, built our own platform, which really actually later then sold on to Ericsson. But it's fundamentally how we're different is that we're extremely focused on machine to machine. So everybody within this company lives and breathes M2M. So this to us is different because we might have a heritage and a history coming from being the carrier, meaning the SIM card, if you like, especially to the industry. That's what we have been. Now going towards more of an agnostic approach on the connectivity side. So it might be that it's a GSM module or a SIM solution that makes sense for many or most, I guess, opportunities and solutions. That's the case. If it makes sense for us to go for another technology, we can do that. I think the point is that we're trying to put the solution and the customer in the center and see how can we build this around that, and that is key. And also this is where partnerships come in, of course. So we can look at this as a new growth area within an industry which is very saturated. So everybody loves machine to machine because it's got low churn and it's a lot of devices and it's out there for a long time. But if we turn around and look at it from a customer perspective, it's also one of the downsides with this is that you as a customer, you commit yourself to partner up with this telecom operator for a very long time. Of course, there are initiatives to go around that. But it's also that we are trying to leverage of something we have, which is good, but I think we also have to consider, is it always the optimal solution? I think we looking at partnerships when it comes to delivering the communication part of things, but if we're completely focusing on that, we will never really, I mean, one of the major issues that we've seen is that where we get most of our revenue from right now are coming from deployments that we made 3, 4, 5 years ago. So we are right now trying to expand our offering through partnerships or on our own to make sure that it happens faster. I mean, we see great business models be terminated or at least postponed just because it doesn't happen quickly enough. So this is really where these partnerships come in, and I think it's been said by most of these previous speakers as well, how this ecosystem, love the word, will continue to function, and I think these gatherings are extremely important to sort of highlight that.
And just picking up on that as well, Thierry, you spoke about the importance of partnerships. What are your recommendations? What are the key success factors to making these partnerships work?
It's actually a oops. It's actually an excellent question. In fact, I think you have, as you said, you have to start from the customer. The issue here is that I would make a difference between two aspects of, let's say, telehealth. One is a lot of people describe Internet of Things, sensors. I can see here a lady with a nice device, wearable device. And that would be the wellness space. In the wellness space, basically, your customer is a consumer. So what you want to do is you want to sell a proposition, a value proposition to that customer, where basically you have either an app or a device, or an app and a device, and plugged together they make sense for the customer. So here, I guess the platform idea can work, but still you have to figure out what, as a telecom operator, you will bring as an extra value to your customers, and I think that's an issue. But the partnership here would be selecting the best app or the best device. Now, moving to a different direction, which is the one I described, which is their remote monitoring of chronic patients. Then you're entering a very different world. In the first world, the data is not really regulated. It's personal data, and basically people create the data by running or doing whatever they want, and then they use it for their own purpose. So there isn't much regulation there. Now, if you move to the other direction, where you have a sensor which is a medical device, then your partner is a medical device company. And here, as Mike said, you have to understand all their constraints, and they have to understand all your constraints. And it's an education process, which is basically goes both ways. This is what we've done. We saw it in a couple of other companies, Weinmann and other ones. And what we found out is that it takes some time for both companies to align and understand what are the difficulties. But then once you've done that, you really pass the M2M level. You're not offering the M2M solution. You're really trying together to deliver a solution to the patient who are the customer of your partner. So it's a more complex situation than just we get together and then again we create something which go to customer. We have this ternary organization where you have the patient, you have the manufacturer, and you have the payer. Because if it's medical, then there is a payer, and the payer has very strict views about what could be reimbursed, what could not be reimbursed. So it's a very different world. And how can I say that? My plea, maybe, here is that we shouldn't confuse both worlds. There may be a gray area where there will overlap, but I don't think that in the future you'll have your own glucometer that, or your own blood pressure monitor that you've bought off the shelf in some consumer electronic shop, and then you'll come to your doctor and you say, here is all the data I've gathered, what do you think of it? And again, I've made that explanation previously, but I'll do it again. The main reason for me is because if you do that, if you bring all this data to the doctor, first of all, he has no idea how that data has been generated. And secondly, if there is in this data something that he misses, but that he should have seen and that detects a problem, and that later on you develop a condition or a disease, he is liable. There is in no condition a proper doctor will accept data that he doesn't have the control of the quality of. So I think that's very important.
Yeah. And Nazrin, continue on that. So you've already launched a number of healthcare services in the US and I think also abroad. How did you manage or deal with this new space, this new regulatory space of healthcare that is very new to the H&T traditional business? Did you need to make some changes within the organization, acquire new expertise, or how did you manage that?
Sure. So AT&T launched the healthcare vertical initially in 2010, and it was about the same time that Affordable Care Act in U.S. a lot of people refer to it as Obamacare, but it's really Affordable Care Act was also launching at the same time, and it was also at the same time that FDA was experimenting and was trying to figure out what to do about the explosion of mobile apps in the healthcare. So we were at the cross point of so many changes in the healthcare industry in United States. Couldn't be more challenging time, because not only you are dealing with regulations, you are dealing with regulations that were changing, and they were changing based on, there were changes initiated by the regulatory agency, but also there were changes due to the push and pull with the industry. The way we dealt with it obviously was we went to the industry experts who know how to deal with the FDA regulations. We hired partners and worked with the partners who have gone through that experience as part of their software development process with the FDA. So they brought that expertise in-house as we were partnering with them for their mobile app. But one thing that I want to share that happened last September was that FDA actually took very important steps towards the right direction as relates to mobile apps, and it was from our perspective was a deregulatory step, and it really lowered the threshold significantly on what would be characterized as a medical device. So medical devices have their own regulations, a lot more stringent, and mobile apps, mHealth apps, initially in 2010 started by being exposed to the same level of regulations as the medical devices, which would have been really a challenge for innovation. In fact, what happened as a result of that initial approach, from the 97,000 mobile apps between Google and Android and app stores, there were only 75 that were FDA approved in September. So obviously, the apps developers and innovators dumbed it down. They were focusing only on wellness and fitness, and and how much do you want to know how many steps you took, right? At some point, you want to know the so what of it. That's very good. We all should know how many steps we took. Nothing against that, but you don't need 97,000 apps to just tell you that. So I think what we are seeing is more and more innovators crossing that boundary, but outside their wellness and fitness and into more clinical nature, and we welcome that. We believe that that would be actually very, very empowering for the consumers. That intelligence in the apps that now can the brave innovators can explore, combined with the sensors and what's being in innovation in medical device industry, is just such a powerful combination that will result to the patient knowing a lot more than the physicians about their history, and as well as all of the tests that's required, done by the approved sensors, and take that data not only to their physicians, but the family physicians, but the physicians of their choice anywhere globally through the telemedicine. So, so we, we also had to deal with HIPAA, for the privacy, with the regulations of medical devices and mobile apps, as well as our own regulatory compliance. And it was all about bringing the right subject matter experts. We actually did a lot of that with partnership, but I do not want to underestimate for this audience the importance of also internal staffing, because you need to have enough of the internal body and intelligence to manage those partnerships, to manage those consultants, to manage all these regulatory agencies, because at the end of the day, the responsibility resides with us. So there was a lot of staffing, recruitment, and growing our own internal know-how that we have done as well.
Okay, thank you. And Ola, to ask you, if you work particularly in the area of automotive, could you just bring to life a little bit the type of services that Ericsson is working on for the automotive sector, but also regulation, is that for you a barrier, an enabler? Are there similar challenges as we hear in mHealth, or is the automotive a different environment?
Yeah, that's a good question. Thank you for a short one. Yeah, first of all, I think that we have had a lot of good stories about automotive here today. Yeah. I would, though, like to emphasize that automotive is the car is one component of a complete transport system. Yeah. So if we should understand the relation between commercial services and regulatory services, I think it's important to realize that, yes, the car is there as one component, together with the travelers, the goods, the transport infrastructure, the road or the rail. And when we discuss machine-to-machine and open data and so forth, I think it's important that we recognize that one. It is a different situation for the automotive industry, I think, to realize that it is now a component in a bigger system. Within Ericsson, we are primarily, as you know, doing business with telco operators, but I'm in a unit responsible for actually doing business directly with this industry. And we believe that we cannot really engage and support the operator if we don't have dirt under our nails and have done things. We're demonstrating in our hall now, the Volvo Car example, where we have provided a service enablement platform for Volvo Car to enable new services for the touchscreen in the vehicle, but also to help them to develop new innovative services. We had the example here about the shoes earlier today. where I think Volvo Car has done, in my eyes, a very creative, innovative thing of defining the car now as a delivery point. So when you do e-shopping, you can, of course, say that I want to have the goods sent to my home or to the office. They have defined the car. And within the connected vehicle cloud now, we have also enabled to have actually time-limited access right to the car, so that you can send the remote lock unlock feature to the e-shopping part. And then you get messaging, of course, that now it is delivered, it's locked, you can feel safe, and you have the goods in the vehicle. So it's our stressed life, I think, having a delivery spot for other things is a good thing. Not saying that it will turn off as a major thing, but just as an example of what sort of innovation do you bring to an industry that traditionally is thinking in very, very long life cycles. We're in the foundry also with AT&T and in the connected vehicle space to see how could this experience now from our direct engagement be leveraged into the operator engagements. And coming to the regulatory thing, I think that if you take the European Union as an example, the European Commission have launched the ITS Action Plan, Intelligent Transport System Action Plan, which is then just seeing that the negative trend in environmental impact, the number of people killed in traffic, and the inefficiency in the transport system is not really improving in the speed it should. So there is, of course, some initiatives now to say that watch out, do implementation, otherwise we'll come with directives and then we'll put it the European delegated act way and have that mandated by law. But then also similarities now between the industries, because you talked about the impossibility to educate the regulator in healthcare. And I think that if there's something that regulators do consistently, then it's perhaps to look very, very independently on enabling technologies for development in that space. 3 examples in transport. Equal. It's a stovepipe solution, end-to-end solution for a good purpose of saving lives and have a more speedy rescue operation. Implemented, as I said, a stovepipe solution requiring the module in the car, the traffic with some special feature in the network, and then back-end integration into the emergency response. We as an industry, I think, failed to define the use case, how this would act from the process outside in view. Because the technology is now, in our meaning, good for short-term purposes, but not really for the long life cycle of a car that have to be exist out there in the system for 15 years. And the technology is sort of not really the futuristic all IP implementation, I would say. Second example is the European tolling, so that truck drivers can have just one device paying it in a consistent way when it travels through Europe. Again, regulation, stovepipe solution. Specific device, traffic, end use, or back-end solution as well. And the same with the digital tachograph. So if we as an industry can explain the horizontal benefit of some of the enablers, and then by clear use cases and in the ecosystem of cooperating commercial players and society players, really see and show how commercial business cases in the connected car can enable society-centric interests. Can I have one more example? Stockholm congestion charging.
Yeah.
For a very good reason to manage congestion in the city. Very successful, implemented, having had a very good effect on lowering the traffic in the city center. Very big suspicious in the beginning. The solution built initially of a transponder being sent out to basically every. So if you want to implement such a service in a city, you have to have all cars enabled with this.
Yeah.
They thought it was a nuisance with a logistic with this small device, so they took it away. But if they could have seen the benefit of that device in providing like floating car data or some sort of information about the traffic density, they could have seen a lot of other benefits from that simple implementation. So I think getting out of this stovepipe thinking, regardless if it is healthcare or transport or something else, I think it's important.
Okay, thank you very much for those examples. And I just wanted to see if there's maybe 1 or 2 questions someone in the audience would like to ask the panelists. There are roving mics around. Any questions or comments? No? Okay, then I propose we then close the session. I really want to thank the speakers and the panelists for all their thoughts and contributions. I think we've seen really the great opportunity that connected living solutions can bring, the importance of partnerships, and also how regulation can be actually an enabler as well, to really make sure we have good, safe, trusted, and beneficial, great beneficial services in the market. Thank you very much. There will be a brief break. For those interested to learn more about the mHealth Grand Tour, to see partnerships in action, that will be the focus of the next session. Thank you all very much.